some basic pathology we should. Low-grade dysplastic, whenever there is a malignancy, we always have dysplasia. In HCC, we have low-grade dysplastic nodules, which transform into high-grade dysplastic nodules. And HCC is a high inflammatory condition. High inflammatory cytokines plays an important role in genetic modifications of cancers. So, as common with other cancers, see growth factors, signaling pathways, BRAF mutations. These are all only rarely mutated. This is the most important because no much targeted therapy available for HCC because we don't express growth factors, we don't express secondary signaling pathways like MEK inhibitor or RAS pathways, we don't have BRAF or we don't have ER2. That's why these mutations are rarely mutated in HCC, so thereby we have less targeted agents for HCC. So just remember these two genes. How hepatitis B integrates into TERT cyclic event is the cell cycle progression and MLL4. Hepatitis C and alcohol have a CT-double-N-B1 integrase. So these are all the point of cell cycle integration, which helps in converting the cirrhosis into an hepatocellular carcinoma. Remember this alone. So which molecular aberration is the core in HCC? It is TERT. TERT, as we read once in our dyskeratosis congenita. TERT and dyskeratosis congenita gene DKC. So these TERT and all telomerase stability. What are telomerase? Telomerase are present at the end of the chromosome, which helps in preventing the cell senescence, cell death, because telomere CC T A G. So CCTTAG. So this is the sequence of the telomere which helps in preventing cells from senescence. When this enzyme is deficient, cells won't have telomere, so thereby cells undergo early senescence. So TET promoter is most commonly affected in hepatocellular carcinoma, followed by the other mutations. So TET overexpression is seen in 90%, TP 53 alterations are seen in hepatitis B virus, and then WNT beta catenin pathway is abnormal in 50% of cases, and VEGF is an important mediator of angiogenesis, which helps in increasing the tumor size also in metastasis. A key signaling pathway in disease progression is HCC. That's why we have VEGF inhibitors in the management of a metastatic HCCs.